So what is a birth plan? Ultimately, it is a record of what you would like to happen during your labour. It could be that you would like a water birth, or to give birth standing up, or it could be a preference of what pain relief you would like to have. It's nice to have some written ideas about what you would like to give the midwives and doctors a bit of an idea of where you want things to go, but ultimately your baby will be born in whatever way it wants, and you cannot make sure that it will follow exactly the steps that you wanted it to. So let's get down to the nitty-gritty. What do you put in your birth plan? So let's start with one that everyone has a lot of opinions about: pain relief. Because everyone is very slightly different. It is important to discuss what options you have at your local hospital with your midwife. You can start off at the natural end of the spectrum or go straight in with medical pain relief. You can start off by using water, massage from a partner, or even a TENS machine, which is quite complicated really to explain, but the basics of it is that you have sticky pads on your back and a little handheld machine that gives electrical impulses to stimulate the natural pain relief in your body. Then, moving on to more medicalised pain relief, you can start off with the good old gas and air and see how that gets you going. Or you could then go on to the next step, which is an opioid pain relief. It depends on which hospital you're at, but it could be pethidine or diamorphine that they offer you as an injection into your leg to provide you with some extra pain relief on top of the gas and air. If you are struggling even more, or you feel that you want to go straight for it, there is always the possibility of an epidural. Some hospitals are offering walking epidurals, however, they're not nationwide, and the good old-fashioned little one into your back and lying on the bed is always on offer. But we just need to mention that if you are very late on in your labour and you're getting to the point where you're actually going to be pushing, an epidural may not be the best option because it wouldn't give you the sensation that you need to actually push. What are your thoughts on an assisted delivery? The options would be that you would have a ventouse to the suction cup to the baby's head, forceps, or possibly even a cut down below called an episiotomy. It is a very personal decision as to which or whether you would like them at all, but have a read around to make sure that you're getting all the information you need. And let's not forget about the other end of the spectrum, which is cesarean sections. Ultimately, if your baby is at risk and you are unwell, maybe a cesarean is the best thing for you. But if you're writing your birth plan, have a little think about which point you're willing to take it to. Do you want them to take it to a cesarean section if you need a forceps? Or do you want them to try and then do that after if it doesn't work? It's really important to read about the reasons why cesarean sections are required and also to know what your rights are with regards to saying yes or no. You can always plan to have a cesarean section as well. They are called elective cesarean sections. Sometimes that may be that you've got health complaints during your pregnancy, or there's problems with the baby during the pregnancy, or it could be that you had a cesarean last time and you don't want to go through a trial of birth called a VBAC, vaginal birth after cesarean section. Do you want your partner to cut the cord? Do you want to have skin-to-skin contact where your baby is put straight onto you after the birth? And how do you want your placenta to be delivered? Yes, your placenta has to be delivered. So your choices are that you can have an injection into the leg to help deliver the placenta quickly, or you can birth it yourself. Basically, you have to give little pushes within about an hour and the placenta will come away naturally. Don't forget about how you're going to feed your baby as well. At the end of your birth plan, make sure you write down whether you want to bottle feed or breastfeed. It's great information for the midwives to know straight away so that they can help get you feeding how you want to. That's all the main points, but it is worth considering. If English isn't your first language, make sure that you write that down. And also, who do you want to be in the room when you give birth? Is it your mum, your granny, Aunt Bessie? We don't know, so make sure you write it down. Finally, the last step is to book an appointment with your midwife for your routine checkup at 36 weeks. She will then have a little look through your birth plan with you to make sure that your ideas are in sight with what would happen. Thank you so much for watching. Keep your eyes peeled for more videos like this and subscribe to Mumsnet. Leave comments below and we will try and answer as many of your questions as possible.